Good afternoon and good morning to some of you on the West Coast, and welcome to the third Rural Minds webinar in our Rural Minds Connections webinar series for 2023. We think this one is particularly relevant today because September is National Suicide Awareness Month. So we will meet our guest, Becky Wiseman, who's going to conduct the training in just a minute. But first, we're very excited about the fact that we have a record attendance for this webinar. Becky, you drew a great crowd. And I want to take just a moment to introduce some of you who may not be as familiar with the Rural Minds organization. Rural Minds is a 501c3 nonprofit, and it was founded by Jeff Winton. The mission of Rural Minds is to serve as the informed voice for mental health in rural America and to provide mental health services and resources. And the impetus for the organization grew out of a personal tragedy in Jeff's life, the loss of his dear nephew Brooks in 2012. And I would urge you to go to the website ruralminds.org and watch Jeff tell his story, because it is much more moving and so touching coming from him. But the other thing we want to talk about is the fact that Rural Minds is very fortunate in that we have some great partners in this mission: the National Grange, the New York FarmNet, who you'll hear more about in just a minute, the National Association of Wheat Growers, and also the American Foundation for Suicide Prevention. We thank all of these good partner organizations. We always remind everyone at the beginning that people watching this webinar, no one can tell or will know your identity. You won't be able to see the names or images of anyone other than those of us who are presenting. But we do encourage you to ask questions, because we will have time at the end of Becky's presentation for a Q&A. And you can do that through Zoom, totally anonymously, and other people watching the webinar won't know. But we would love for you to send in your questions. So please do that. But I'm going to let Becky tell you about Talk Saves Lives, which is a suicide awareness and prevention training that she is presenting today. And we are really looking forward to this, Becky, because we know what important information it is. So with that, I would like to turn it over to you. I would ask you, as you begin, to please tell us a little bit about yourself and about all the great work that's being done at New York FarmNet, and then we'll commence the training. So with that, Becky Wiseman, the floor is yours.
Thank you very much. Really appreciate that, Jillian. It's a pleasure to be with you all today. Again, my name is Becky Wiseman. I'm a clinical social worker, and I work with New York FarmNet. For those of you who do not know, New York FarmNet, we are a program that's through Cornell University. We are funded through New York State's Office of Mental Health and New York State Ag and Markets, besides some other kinds of grant funding that we have. But we've been very fortunate to be able to take this course, this teaching course in Talk Saves Lives, because what we'll find out as we go through this program is that it truly is talk that saves people's life. So I'm going to begin sharing my screen so you all can follow along. And let's see. Just making sure that works. All right. So suicide is a sensitive topic to discuss. In fact, you know, I've been in groups where people will say, oh my, are we going to talk about that? That's going to be really hard to talk about. And yes, it is. It is a sensitive topic. And if anyone needs to step out or to take a break, or this is disturbing for you, feel free. We have the 988 number, Suicide and Crisis Lifeline, on every one of our slides today. So please, if you feel like you need to talk to someone during this process, please feel like that you can do that. Overall, today I hope you'll be able to learn more about suicide prevention, because suicide is preventable. And as we become more comfortable talking about the issues, then it becomes easier to talk with other people. So here we go. Suicide is a health issue. It's a very complex health issue. And despite its complexity, suicide can be prevented. Just like there are warning signs with other health crises and cardiac arrest, there are risk factors and warning signs that can help us see and help us prevent people from dying by suicide. Like other health issues, preventative care, prevention can start early with the times of crisis and being able to support people during these difficult times in their life. Typically, a life can be saved if you allow time for the person's suicide risk to subside or to get through that period of distress and get the mental health that they need. To prevent suicide, we really need to identify people who can be suicidal or may be suicidal, as well as take an active role in helping to connect them to other sources of support before they can end their life. Today, we're going to be looking at 4 topics. The first is we're going to look at the scope of the problem to provide all of you sort of an overview about suicide, who it affects, what can be done to prevent it. We're going to look at some statistics, give you an idea of the scope of this problem. We're going to look at research, what's being done, including the risk and protective factors that relate to suicide. And then we're going to talk about what works and what can all of us do to prevent this leading cause of death. How we talk about suicide matters. So before I really get into the nuts and bolts of this presentation, I just wanted to go over some terminology that's used when we talk about suicide. It's important that we model the language so that we don't perpetuate the stigma of suicide and mental health conditions. So much of the time, in fact, myself, many years ago, it was acceptable to say someone has committed suicide, or they failed a suicide attempt, or it was a successful suicide attempt. But the baseline of language now is we avoid those phrases, committed suicide. They have a negative connotation, and instead we encourage that someone died by suicide or they ended their life. There was a suicide attempt or a death by suicide. So educating the public about suicide is critical because it encourages help seeking, raising awareness of the risks in vulnerable population and advocating for new interventions and prevention strategies for those at risk. When suicide is talked about safely and accurately, we can help reduce the likelihood of its occurrence. So suicide is a significant issue that affects individuals, families, and communities worldwide. I wanted to start with some statistics that demonstrate the scope of this problem. Over 800,000 people die by suicide each year. It's a global problem. And it's also a close to home problem. Here in New York, we see farmers and people in rural communities, their chance of dying by suicide is 3.5 times larger than the population in general. So it's important to understand that it's critical to understand how quickly throughout our lives somebody dies by suicide, every 40 seconds in the worldwide. In the United States, suicide rates are recorded by the Center of Disease and Control. So according to the CDC in 2020, almost 46,000 people died by suicide. This is the most recent data available. And this makes suicide the 12th leading cause of death. It takes more lives, suicide does, than homicide, war, and natural disasters combined. These numbers are one of the many reasons that it's important to talk about suicide like any other cause of death. The more we talk about it, the less stigmatized the idea that we all face struggles and we all need support. For every death by suicide, it's an estimate that 25 others attempt. That's about 1 million Americans each year who survive a suicide attempt. When you think about loss, it impacts many people in the community, and suicide is no different. The loss affects their family, our friends, co-workers, neighbors, schools, faith communities, and it's estimated that the majority of Americans will experience a suicidal loss over the course of their lifetime. I wanted to move on now to the research that's being done. But before I do that, I just wanted to point out that in rural communities between 2000 and 2018, suicidality rose by 48%. And that was compared to the 34% in urban areas. So it's fascinating and also almost heart-stopping that rural areas of the United States are at higher risk of suicide than areas in the urban areas. It's also a fact that the suicide risk in rural areas are different according to gender than they are in urban areas. We've been able to see that middle age has generally been identified as a time of high risk for suicide. However, in rural areas, it's the young men from in the ages of 20s and 30s that experience higher suicide than the middle-aged men. And among rural women, the rate is the highest among those around 45 to 49. It does, I mean, it really, no matter where you live, whether it's in an urban area or a rural area or a farming community, suicide impacts all. However, the rural communities have seen the greatest increase of nearly 50% over the last few years. Research, though, in the past decades have scientists been studying suicide, and they're shedding light on some critical areas that drive up the risks and what amounts to effective suicide prevention. We have still more to learn, but this section will provide you an overview of the research findings and the future goals. One of the questions that all of us ask, why do people take their own lives? And what we've learned in research is that there's no single cause for suicide. It most often occurs with several stressors. Health converges to create an experience of hopelessness and despair. So it's like a convergence of stress, of health issues, of hopelessness. And so there's no one single cause. Research has consistently shown that the large majority of people who die by suicide have a mental health condition at the time of their death. It may or may not have been recognized by the person or their loved ones, and it may not have been diagnosed or adequately treated through the years. That said, research has also been clear that mental health conditions cannot explain the whole of the story. The vast majority of people who have health conditions do not die by suicide. In addition to mental health conditions, other factors arise also. We've learned that the brains of people who die by suicide differ from those who die from other causes in terms of stress, structure, and function, specifically in the area related to stress response and impulse control. We've also learned that most people who are suicidal are ambivalent about taking their life. Part of them wants to live, and part of them also wants to die. This research has informed us of some key strategies in suicide prevention that we really, when we're talking with somebody, we want to engage them in the part of their person that wants to stay alive and help them create distance from part of themselves that wants to die. And one way to do this is to help the person connect with reasons for living. while at the same time decreasing the visibility and presence of things around them that may facilitate their desire to die. Perspective on suicidal persons. There's a crisis point that's been reached. The pain seems unbearable. And for a moment, it's just the pain makes ordinary thinking nearly impossible for a person that is suicidal. Research has helped us determine the key factors, the risks of suicide, the health, the historical factors, and environmental factors. Just like heart disease, because of high blood pressure or disease of the heart, some people are at risk for higher suicide than others. The main factors here can be grouped into three categories: health factors, historical factors, and environmental factors. The first type of risk factors include the health factors, such as biological and psychological medical conditions, mental health conditions. As we've said, most people who die by suicide have an active mental health problem at the time of their death. And believe it or not, depression is the most common mental health condition and the one that is the most associated with suicide. Mental health conditions aren't the only risk factor with suicide. People also has mental health issues. Chronic pain, serious head injuries have also been found to be a factor for increased suicidal risk. The second type of risk factors include historical factors, such as a family history of suicide, childhood abuse, and also family history of mental health conditions. A third type of risk is the environmental factors that involve circumstances in a person's life. Often there are aspects of a person's environment that can contribute to their overall level of risk. Having access to a way of killing oneself is referred to as access to lethal means. 50% of the suicides in the United States are by a fire weapon, a gun. And killing oneself is referred to as having that lethal mean. Having that access is a lethal mean. So prolonged stress includes harassment, bullying, relationship problems. And to better understand the risk, here's an example of a set of risk factors that can converge on a person who is suicidal. When someone dies by suicide, often the only story that is talked about is environmental factors. Like people see, if you read in the paper, that there was a life event, they broke up, they've had bullying, they've had a major job loss, someone in their family has died, there's something stressful, entirely horribly stressful has happened in their life. They're drinking more than usual, prolonged stress at work. Maybe they're suffering from depression, anxiety disorders, and then their work life has become increasingly stressful. Perhaps they've also been drinking more than normal. Looking to the future, research can help us find the best ways to fight suicide. There is hope for suicidal, the importance of helping people that are suicidal. We're looking also for biomarkers. For example, sometimes something is testable in a blood sample that could help identify those people at risk. So more and more research is being done. It is not completed, but we're all looking to the future for better ways to fight suicide. And now we're going to turn to prevention. Just like there are risk factors that increases a person's risk for suicide, there's also protective factors that lowers that risk. If you are protective about mental health and make an effort to get healthier, you protect yourself. Feeling connected to family, feeling connected to the community support, whether it's to the Grange, whether it's to your local church, whether it's to your synagogue, whether it is to your friends, your people who you feel compatible with. Those are protectors against suicide. When someone is struggling with depression, these protective factors that may normally be strong, they can erode and temporarily weaken. Many times people pull away, and that is like an indicator that something is wrong. If you see a person who used to be engaged in connecting with their community or engaged in the culture, religious beliefs, and even like when I've talked about in farming, when their farm all of a sudden takes on this look as if nobody really cares. The person is more disheveled. These are all possibilities of indicators of someone who is very depressed and may in fact be contemplating suicide. Because mental health care is so important to preventing suicide, we're going to focus on the topic for the next few minutes, and getting effective treatment for health conditions like depression and anxiety can prevent suicide. We need culture where everyone knows to be smart about mental health. We now have our new suicide crisis lifeline, which is 988. Thankfully, it's reaching out to so many individuals. You can text, you can call. It's a way of talking to someone and getting help that you need. Unfortunately, in rural America, many times our mental health facilities are very limited, in fact. But if we can talk with people and encourage them to seek help for their mental health conditions, it is critical for them to find and talk with someone who can help them through a professionally trained. Taking care of our mental health is just as important as taking care of our physical health. And mental health professional is a sign of strength. Many times, I know in rural America, it's like you pull yourself up by your own bootstraps and you get on with life. There's no such thing as wimping out, where it's really important that when people are struggling, that they see seeking out a doctor, a mental health professional, discussing treatment options. These are the lifeline for them to get help. It's not a sign of weakness. In fact, it's a sign of strength. The good news is that advocacy efforts are improving access to mental health services. The law is now requiring that insurance plans cover mental health services, just like they do physical health. Again, these are services that are becoming more and more available. They're not happening fast enough, but the more we listen and support our fellow human beings, the more support that we can provide people in need of mental health services. Self-care also strengthens mental health. We all, whether we're mental health providers, whether we're working in any kind of industry, we need to find strategies that optimize our own physical health. And people can do the same for their mental health. In addition to professional mental health care, protective self-care strategies like good sleeping habits, exercise, nutrition, and stress management can also play a critical role in protecting mental health and promoting resilience. And I encourage those who have contact with a friend, with a partner, with an associate who are exhibiting signs of depression, anxiety, that saying, hey, let's go for a cup of coffee, or let's meet and take a walk. Those are all ways of reaching out to those people and showing that you care. Prevention also includes support for those that are touched by suicide, support for the loss of one person. It profoundly impacts so many people. It's important that survivors have the support they need to heal and reduce their own suicidal risk. And since those with lived experiences, those who have attempted suicide or who experience suicidal thinking are at increased risk, we need to make sure that they have the support they need also. People who are at a crisis point, the most important thing that you can put between a suicidal person and their way of ending their life is time. Research shows that by temporarily reducing a suicidal person's access to lethal means, we give them the suicidal individual time to diminish that risk, time for someone to intervene, and someone to provide the mental health support and resources. I was called not that long ago through New York FarmNet that an individual, a farmer, was experiencing life-changing circumstances. And within the hour, I was able to go and meet with him. And he had been given divorce papers that morning, and his whole life had been wrapped so closely with his wife and with the farm and with their rural lifestyle. And he was just overwhelmed and did not expect such a delivery. We sat for an hour out in the field under a tree while he talked and he cried, and I listened. And that is so important. Active listening to those people who are in suicide distress, who are in a suicidal crisis. And also not like offering suggestions for, well, if you do this, everything will get better. No, they need someone to listen to them. In most cases, when a suicidal person doesn't have current access to a means that has been on their mind, they won't substitute with another method. The person I was talking about, he had guns. And so I'm like, what's going to happen with you guys? Are you willing to give the key to the safe to your son? And so we set parameters around how he would deal with getting control over the gun situation and placing them with his son. Those are absolutely important methods of helping someone prevent suicide, and by limiting their access to lethal means. During a period of high stress and high risk, the safer their environment is, the better the chance a suicidal person has of living through that crisis period. Suicidal prevention research has looked at a number of ways to create safer environments. They've looked at installing carbon monoxide sensors in cars. They've looked at researching barriers on bridges to deter suicides. I know by working with Cornell University, they have these cages that come out, barriers over their bridges, because many students have committed suicide. I say that, and I don't mean to say that, because as you can tell, it is part of our vernacular. Individuals who have died by suicide at Cornell, they now have barriers to prevent that. Restricting access to lethal medications, firearm safety is critical to reducing suicide rates in the United States. Now I wanted to also look at ways that we can review suicidal key risks in prevention efforts. We've already talked about some of what we can do. Listening is an absolute lifeline for those. It's important to have a caring, supportive conversation with someone. One of the things I learned early on in my work is that if you ask a person, are you feeling like you want to die? Are you feeling like you want to die by suicide? Is not going to make them run out and kill themselves. It is in fact a relief that they have someone who is able to talk that language and show supportive conversation. You may be worried about that person, but allowing them to share what they're experiencing, having a conversation with them, is a way that you show you care and allows you to gain more information about their level of distress. People want to talk, but so many times the stigma attached with it, the rigidity around not talking about suicidal risk prevents people from talking about it. So watching for warning signs in yourself and others. We've talked a little bit about that You know, if you live in a rural area and you notice that a person is like not showing up to the regular weekly book club or monthly book club, they're not showing up to their, the breakfast with the guys. There are many signs. These are warning signs. And I'm not just saying missing one session. I'm saying a pattern, a repeated pattern of not participating in activities that they once participated in. It's important to pay attention to both the risk factors that we've been discussing and warning signs. If you see warning signs, it's so important that you reach out to that individual in your life and talk about with them, reach out to them if they're struggling, encourage them to seek mental health services. And if their regular anxiety and their depression is interfering with their daily life, encourage them to reach out and seek help. As I said, 988 is a wonderful opportunity to talk to someone who will listen. Text someone who will listen. Suicide warning signs are typically displayed in three main ways. Through a person's talk, what they talk about, their behavior, and their moods. Many times people who are suicidal talk about ending their lives. And I've run across people who have been joking. Oh, I just feel like, calling it an end. And I've stopped and said, that's not funny. Are you serious about this? And I've had them say, oh, Becky, we've talked about this. Our whole family talks about this that way. And I'm saying, but it's like changing the culture of how we talk about suicide. It's not a joking matter. And we need to take that person seriously. Stop. It may feel uncomfortable. You may think on some level, this is just a joke, but it's helping people learn to communicate in different ways about suicide. Some people might say they have no reason to live. Others may say, they feel trapped, they're a burden to others. They may feel overwhelmed, they have unbearable pain. These are all indicators through their talk that these people need support. And then there's the behavior. We can see increase in alcohol use or drugs. Speaking to the person that you're aware of this. Dan, I've seen you have this increase in your drinking. What's going on? Showing a concern for that particular person. People thinking about suicide can display other kinds of behaviors. They may have a difficult time sleeping, or they may sleep too much. It's one or the other many times. They're up night and day. They cannot sleep, or, they're up for an hour and they're sleeping 23. It's really an indicator. They may start acting recklessly, driving their car with their eyes shut. That is like, oh my goodness, that's a major sign. And many times they'll tell you that, oh, I was just seeing how far I could go. Well, that is not funny either. And we really need to pay attention to what people tell us and what we're seeing in their behavior. We've already mentioned that activities, they've drawn away from their activities, they're becoming more isolative, not just one or two times. This is over a period of isolation and withdrawal. And then their moods. People at risk for suicide can display often subtly, any of the following moods: depression, apathy, rage, irritability, impulsiveness, anxiety. Moods one would expect someone who feels overwhelmed and desperate. And again, we're not talking about, God, I feel, today's been a rough day for me. I'm having a really hard time. We're talking about someone who They change in their affect. Their face changes. They don't show any kind of emotions. They're just flat. We all have ups and downs in our moods, but if you notice something that's changed, it's uncharacteristic or concerning, it's really important that you speak to that person about what's happening and what you're noticing. And then trust your gut. You know, our gut really tells us what we need to do. There's a lot of things to look for. So to sum it up, look for changes in behavior and trust your instincts. Assume you are the only one who's going to reach out. In too many instances, people talk about their concerns for someone amongst themselves, but they hesitate to reach out to that person directly. There's a rule of thumb. If you're wondering if someone is depressed, overly anxious, that's a sure sign you need to reach out to that person. And the same goes for you. You know, if you're having suicidal thoughts, that's a sure sign that you also need to seek help. So how do you reach out to someone? Well, you talk to them in private. You listen to their story. You express concern and caring. And you ask directly. Don't be afraid to ask, are you thinking of ending your life? Are you thinking of suicide? Do you have a means to die? Encourage them to take mental health services seriously. And in crisis, take them for help. Such as if I had been talking back about the man that I sat with, and he talked for an hour more about his sadness, his depression, his thinking there was no reason to continue living. If he and I had not been able to negotiate what would happen, how he could store his firearms carefully and not have the key, I would have felt and I would not have been able to get an agreement with him that he would not take his life. I would have had to call 911. 911 is what you call when you cannot help someone move beyond their reasons for dying. There's some ways that we need to support someone who's suffering. Again, we avoid minimizing their feeling. It's so often with us as human beings, we want to tell people, oh, it's going to be all right. Tomorrow you'll feel better. This is like minimizing their feelings. We don't know that tomorrow's going to be better. So we avoid that. Those of us who've never experienced major depression, we literally may not be able to imagine what that feels like. So we can even say that. I can't imagine what you're going through right now and how it must be impacting your life. Avoid trying to convince them that life is worth living. If a person is in a crisis, they're not thinking clearly. And, philosophical debates about why life is worth living isn't helping. They're have tunnel vision. And we can't fix it. Just like a person who is having a heart attack, you wouldn't want to tell them to start exercising and get yourself a healthy diet. You're going to be okay. Get yourself a healthy diet. No. When someone is in crisis, what they need is to be heard and listened to. Listen without offering a judgment. Listen without offering a solution. Just listen empathically. And encourage them to find professional help. If you think they might have an attempt on their life soon, as I've said just a few minutes ago, do not leave them alone. Stay with them. If the situation puts your own safety at risk, you need to leave the area immediately and call 911. If they cannot remove themselves from lethal means or are potentially dangerous, you need to call 911 to have someone come and help. So as we said, we have the lifeline I think it's very important to note that 988 is a new suicide and crisis lifeline that is expanding across the nation. And it's so important to have that ability to tell people, please call 988, even if it is just to talk to someone. And I believe if it's an emergency, we've said that, call 911. Together we can create, this is like the ending that I really want to pass on, that there is hope for people who have depression. They have accumulating factors of life circumstances that are just beyond their ability to control. They feel hopeless, they feel helpless. There is there is hope. And we can help create that culture of hope, and it's smart about and help people understand that mental health is within reach. We can help people, we can help save lives, and we can vastly improve the lives of many more people. Thank you for listening. I thank you for coming today. And of course, we're going to take some time to have your questions. So,
Thank you, Becky. That was very sobering in some ways, but very informative, and hopefully giving people some good ideas on what they can do to help, because we've heard this at Rural Minds a lot, that people have this fear. I'm afraid I'll say the wrong thing. I'm afraid that if I mention suicide, this will put an idea into their heads. Any other thoughts on dispelling that notion and helping people feel comfortable reaching out when they do have a concern about someone that they care about, or someone in their community that they're worried about?
Right. Listening. I mean, listening is like the key. It's easy. However, it's not easy to sit with someone who is in such stress in their life. So it's hard, but if we can just sit still, pay attention, keep eye contact, be supportive, non-judgmental, one of the best things that we can ever do.
Excellent. Oh, thank you so much. We have a bunch of questions from the folks watching, so I'm going to start with this one, because it kind of ties into what we were just talking about. What are effective phrases to say or questions to ask to help someone? And this person phrased it, focus on their reasons for living. So, and you just mentioned talking about life is for living. So how would you address that?
First, I would listen to what's going on in their life. I wouldn't start with, you have so much to live for. I would begin by, tell me what's going on. Tell me what's happening in your life right now. Not so much asking them specific questions, but asking them to explain what's happening right now that would make them want to take their life. And by the end, and who knows how long that might go. I mean, 45 minutes, an hour, offering support during that. And then toward the end, I always ask, do you have a plan? What is your plan? And then we talk about that. And then at the end, when we get through, there's no like, okay, we started with question one and then move through final question. But at some point in that discussion, we talk about what's, their children, their grandchildren, the things that are important to them in their life.
But you make it specific to that individual, but it's but open-ended to start out. So could the initial question, rather than even mentioning suicide, could the initial question be, hey, I've noticed that you haven't been coming to coffee in the, at the diner for the last couple of weeks.
Right. Oh, yeah. Right. We don't know if that person is suicidal. We just know that, they've missed it for like a month, and geez, David, what's happening? I miss you. Is anything going on in your life? That's causing you to miss. Maybe they're sick. We don't know. But asking open-ended questions.
Excellent. Okay, I've got tons of questions. This one just popped up, and I think it's very interesting because you talked a lot about the 988 number. And the question is, does the 988 number, do they have to report to authorities? Can a person call and not be reported to some other organization or, some,
They don't
something?
even have, right. They don't even have to give their name. They can just talk to someone. So it's not, they don't get reported. If they're homicidal, that's a different,
Yes.
and the answer would be totally different. If they're homicidal, then yes, that has to be reported. If they're having suicidal ideation, or they're just extremely depressed, they know someone who is, having suicidal ideation, no, you don't even have to give your name.
It's just that sympathetic ear.
Right.
And
they are trained. They're trained to work with people this way.
That is awesome. I'm going to go back here a little bit. Okay, I think we talked about that. Someone, a very specific question, to speak to the connection between untreated or inadequately treated ADHD and suicide.
Can you say that again?
They're asking about the connection between untreated or inadequately treated ADHD and suicide.
Okay. As far as I know, ADHD isn't a diagnosis that's attached to suicide. Not that I know of, and maybe I'm, missing out here, but people who are depressed, people who are anxiety ridden, people who have ups and downs in their life, those are the people that are many times, but it's a confluence of issues. It's not just, people who are depressed don't naturally kill themselves all the time. I mean, that's not the one thing. People who have lost a parent don't naturally then, die by suicide. It's a combination and a confluence of stressors that are beyond their control. They feel it's beyond their control.
Absolutely. And maybe this ADHD question, this is a situation where that individual needs to talk to their own healthcare provider or the
absolutely
healthcare provider, because that's very specific.
Right.
I'm reading something. Okay. This person, I'm going to read this because this is a great comment here. Said, thanks for the excellent presentation, Becky. You shared some very important information that will help all of us. After a person calls 988 during a time of crisis, what happens next? For example, does the operator refer them to a longer term solution, such as a therapist? What's the next step after that 988 call?
I wish I knew that exactly. I don't exactly. I think that if you're a friend of that person who's called 988, that's the beginning step. It's a step in a process of getting help. And I would absolutely recommend that person take the next step, which is finding further support. And it's always, the mental health centers are a place to go. A private practitioner is a place to go. And we have a paucity of that in the United States. You may be put on a waiting list, and all of those circumstances are really difficult. But finding somebody that you trust, whether it's your priest, whether it's your clergy, whether it's your doctor, even your family practitioner, these are people that can talk to you and be supportive of you.
Can help. Yes, because
Yeah.
sometimes in rural areas, we hear that there's not quite the resources available, but
Mhm.
it may take a little more work to find them.
Right. Right.
Seek out as much as you possibly can.
Well, just one thing is that here in New York, we have the New York our program,
Yes,
and it is like it's one of the best programs, I think, in the United States. I wish we could duplicate it in every state. But New York FarmNet is particular to New York. And what we do is we provide both a family consultant and a business consultant, because many times people call up and they say, oh, we're having problems with our budget. We really need to talk to somebody about our budget. So both a family consultant and a financial consultant go to the home. And what we many times discover is, there's so much going on in the family that they're a long way from getting a budget, because they can't talk to each other. So sometimes we have to work through those issues before or somebody has recently passed away or been diagnosed with, a debilitating disease. So those, in New York State, in the rural agricultural community, New York FarmNet is a wonderful place for access.
yes. And maybe sometimes the budget is the only question they feel comfortable asking, and then you can go in and
Right,
uncover some of the other things that are
right.
happening in these people's lives. But you're affiliated through Cornell. So
Yes.
I'm wondering if maybe in other states where there's county extension, that type of,
Mm-hmm.
at least that would be a place to ask if there were
Right.
services available.
Absolutely. Absolutely.
We at Rural Minds, we have a great program coming out with the National Grange very soon. So I'm going to give a little
Yes.
plug for that and watch
Oh,
for more
good.
details about that coming up
Right.
very soon. Well, this question ties in as well. Beyond pastoral care, what role do you believe faith communities serve in prevention and walking alongside people feeling hopeless and feeling despair?
So important. I grew up in a rural community where the church community was so very valuable and important, because people felt they belong. They belong to a community, and that community is their support. And many times it was their family. So I don't mean biological family, I mean their emotional family. And so absolutely, faith is one of the most valuable resources for many people in rural and urban communities both.
Excellent. Thank you. Um, I'm just another question for you here regarding the person says that you said that health benefits now have to cover mental health. But I think many people fear the information will get back to their employer. Can you advise on if employers can see any information, including billing information for mental health care, or is that covered under, some of the privacy regulations that we have in place?
I wish I knew that exactly.
It's a good
That's a
question.
wonderful question. I don't know exactly. I don't know if HR and companies have access to, I don't think they have access to your doctor's appointments and what you talk about in your doctor's appointments. I don't think that
I would
they have access with that.
I would assume that's covered under HIPAA, but we don't want
Right.
to. Maybe that's something that we can find out more about. And I'm making offers for the Rural Minds team here, but maybe we can
Okay.
post something
I
on our website, because it really isn't. I'm sure it's something that people would be worried about.
Right. Absolutely. But you're right. The HIPAA laws do not allow that. Do not allow the transfer of either your physical or your mental health condition to other people. It's
Okay, so
absolutely private. Thank you for reminding me.
okay, well that's good to remember. Yes, because I could certainly see where
Absolutely.
this goes back to this stigma. We are
Right.
still trying to work very hard to remove that that stigma that sadly many people still
Right.
feel. Interesting question. Any recommendations on how to communicate with teenage boys? You
Mm.
you said watch for the signs, like if they quit talking, but how do you, if the young person is not talking, how do you reach out to them? How do you
Mhm.
get them to talk, or get them the help that they need?
Right. I have worked with teenage boys. I think they're great. And I think the one issue that I have seen happen in families, when I end up, the family called me and said, Becky, our son needs help. He's being disrespectful. He's being, he's not doing his chores. He's not talking. And so one of the very first things I do is I just sit and say, hey, tell me what's going on, and it's so important to listen to them and not judge them, and to ask open-ended questions. So many times we're taught as just, we grow up with this. Well, are you cold? Are you getting your work done? Why not? Why, we come across as if, I had a teenage boy myself, and so I know how easy it is to say, Ethan,
Yeah.
if you don't
And
do this, you're going to do that.
they take it as being judgmental and not, but
Yes.
is it helpful for a parent, since they are the parent and they're so close to the situation, to find someone else who to come in and say, hey,
Yes.
do you want to talk? Is there something that's bothering you that I can listen to you? Tell me about it,
Right.
and gain their trust. So
And
maybe it's
yes,
helpful
it
to
is.
send an ear.
Right. It is, because the therapist is we don't have anything in the game. We don't have we just are a trusting person that they can talk to. We're not going to judge them. And many times we become the adolescent's interpreter to their
Ah,
parent.
oh, I love that. Well, I'm going to end with this. We're running out of time, as we always do, because this is so interesting. But what would you say is the key takeaway from your presentation today that people should remember?
Active listening. Active listening means not offering solutions, not offering, well, it's going to be okay tomorrow, and being willing to sit with stories that are painful. Many times people, including we don't want to hear that pain, because we then feel like, oh my God, it's on us too. But if we sit and listen, the person can get through it. And so that's my takeaway. Active listening.
Active listening. That's awesome. Becky Wiseman, thank you so much. Thank you to New York FarmNet for all the good work that you do. I am going to wrap this up quickly here, as I said, as usual, but we really appreciate this great presentation. To those watching, you will be receiving a short survey. We encourage you to please share with us your thoughts on today's presentation. I mean, we have gotten great ideas for other sessions like today's session from the feedback that we receive from the people watching. So please, we would hope that you will be kind enough to share your thoughts with us. Want to thank the National Grange, the National Association of Wheat Growers, and the National Foundation for Suicide Prevention for their partnership. And I want to remind you that Rural Minds is a nonprofit organization that relies on the generosity of donors. If you find this valuable, please share this information. This webinar will be online shortly, so people can watch it. It will be available in a tape presentation. So spread the word to your friends if you find it valuable, and follow us on all of our many plethora of social media platforms. And we have another great webinar coming up in November. This is in partnership with the folks at Janssen, and we are going to be talking about providing care to a family member with schizophrenia. So please go to the website. You'll find out more information about our next webinar. But thanks to everyone for joining today, and especially to you, Becky. Great information, and we do appreciate it. Enjoy the rest of your day, everyone.